For 3 years, labs have argued safety alignment makes generative models ready for mental health care. But recent research has identified a critical flaw in that logic. The systems built to protect users are the specific cause of clinical failure. A study from Penn State, Emory, and Georgia Tech tested 4 models against 250 therapy scenarios. They found that as patient severity increased, therapeutic appropriateness collapsed to 22%. Researchers traced this to safety training that teaches models to refuse harmful content. But in therapy, patients must discuss trauma to process it. Because models are trained to avoid these topics, protocol adherence hit 0 for half of the models tested. Applying broad safety filters to conversational AI blocks the specific clinical mechanisms required to treat patients. An audit from the Harvard T.H. Chan School of Public Health suggests this failure is systemic. The study identifies identity contingent withholding, where models change answers based on who is asking. In 3,600 test cases, safety-trained models gave physicians significantly more information than they gave patients for the exact same questions. This created a 38-point gap in information access between the two identities. When a doctor asks about a medication taper, models provide detailed clinical pharmacology. When a patient asks the exact same question, they hit a wall, receiving a generic referral to seek professional help and no specific medical information. These 2 papers document a consistent pattern. Safety-trained models are currently unsuited for unmoderated clinical routing. Despite these findings, the same week the research was published, major tech corporations moved to deploy these models to billions of users. At Apple's Developers Conference, Dr. Sumbul Desai announced a default-on safety filter. It is an on-device system that intercepts and blurs visual gore for users under the age of 18. Hours later, on the same stage, Craig Federighi introduced Siri AI, opening the platform to third-party extensions like ChatGPT and Gemini. While the visual filter is specific, Apple left the safety specifications for mental health queries on Siri AI unspecified for those teenage users. Simultaneously, Meta expanded its chatbot content cap globally for all teen accounts on Instagram, Facebook, and Messenger. The standard Meta uses to govern these clinical conversations is a movie rating. They are using the Motion Picture Association's PG-13 rubric, originally built for theaters, to manage chatbot interactions about self-harm and eating disorders. By relying on movie ratings and visual filters, these companies are shipping conversational AI without addressing the underlying clinical risks identified by researchers. This rapid deployment is happening while the federal agencies responsible for healthcare oversight are largely stalled. The FDA's digital mental health framework remains undelivered. The commissioner resigned in May, leaving the agency under an acting placeholder who has reportedly declined to take the permanent role. While the FDA search continues, the Centers for Medicare and Medicaid Services has already moved forward. Administrator Dr. Mehmet Oz issued a final rule to begin paying for digital mental health devices under new billing codes. However, these codes only cover devices that use deterministic protocols and have been cleared by the FDA. The federal payment system is currently structured to exclude the generative chatbots being shipped by the major labs. Without federal standards, the ecosystem has defaulted to a state-level crisis. In Pennsylvania, an investigation by Spotlight PA found 5 companion chatbot platforms operating without any clinical oversight. These platforms allow chatbots to adopt the persona of a psychiatrist. When prompted, the AI claims to be a licensed doctor and produces a fabricated state medical license number on demand. These 5 platforms continued this practice even after the state of Pennsylvania sued a 6th company for the exact same unlicensed practice of medicine just weeks earlier. The absence of a federal framework has created a space where platforms can actively impersonate clinical professionals without consequence. One configuration that successfully navigates these failure modes shifts the role of the generative model. Rather than acting as an autonomous therapist, the AI is restricted to a support role within a human-led system. Grow Therapy's AI coach follows this model. Unlike a standalone consumer chatbot, it operates as an in-app feature layered on top of an existing relationship between a patient and a licensed therapist. The system uses a 3-layer safety mechanism: automated quality scoring, back-end audits by clinicians, and a direct alert system that routes the alert to the specific licensed therapist assigned to the case. When the system detects a crisis indicator, it immediately halts the chat. The model does not attempt to intervene or provide advice. Instead, the AI triggers an automatic handoff, and the licensed human therapist makes the follow-up call. The stability of this architecture depends on the clinician in the loop. The model provides the signal, but the human professional retains the duty of care.